Welcome to Tocilizumab Chronicles Beyond the Cytokine Storm, where we explore the intricacies of tocilizumab and its role in medicine. I'm your host, Dr. Shikha Agrawal, and joining us today is Prachi Virat, our microbiology researcher with a passion for microbiome and bioinformatics. Welcome to the show, Prachi. Let's tackle an important topic in today's episode on managing infection risks in context of tocilizumab and opportunistic infections.
Feels great to reconnect. Thanks for inviting me again, Dr. Shikha.
To start, Prachi, tocilizumab affects the immune system, but does that actually make patients more vulnerable to certain infections?
Yes, it does. Since tocilizumab blocks the IL-6 receptor, it modulates the inflammatory response and weakens one of the immune system's pathway for detecting and responding to infection. This can make patients more vulnerable to bacterial, fungal, and certain opportunistic infections like tuberculosis, pneumocystis, girovesi, pneumonia, PJP, and reactivation of hepatitis B. Additionally, because CRP levels and fever may not rise as expected, infections can sometimes be hard to detect early.
Great explanation. Thank you for laying that out so clearly. Given those risks, what strategies can clinicians use to prevent opportunistic infections in patients treated with tocilizumab?
That's an excellent follow up. Prevention starts with a comprehensive pre treatment screening, including testing for latent TB, hepatitis B, and sometimes HIV, depending upon patient's risk factor. Prophylactic measures like giving antiviral and antibiotic prophylaxis in high risk case can be considered. It's also crucial to update the patient's vaccination status before initiating therapies, including pneumococcal, influenza, and hepatitis B vaccines.
Really practical points. I appreciate you highlighting those preventive strategies, Prachi. If a patient on tocilizumab develops an opportunistic infection, how can clinicians manage that?
Another important question: management typically involves pausing tocilizumab therapy until the infection is controlled. Empirical broad spectrum antimicrobial might be needed if infection is suspected. If it's a latent infection that reactivates like TB or hepatitis B, targeted treatment should be immediately begun. It's also important to monitor inflammatory markers carefully, though CRP might remain low, so clinical judgment is key.
Thank you, Prachi. That's a really clear breakdown of the management approach. When clinicians are weighing the benefits and risks of tocilizumab, especially in patients prone to infections, what are some key considerations they should keep in mind?
Clinicians need to balance the severity of the underlying disease against the patient's infection risk profile. Factors like age, infection risk, previous infection history, and immune status should be carefully considered. Shared decision making with patients about these risks is essential. Regular monitoring post initiation, patient education on infection signs, and prompt reporting are also critical part of safe treatment.
Excellent. Thank you for walking us through those thoughtful considerations. Before we close, what would you say are the key takeaways for our listeners from today's episode?
I would say the big message is that while tocilizumab is highly effective, especially in severe inflammatory conditions, it required a proactive infection risk management plan. From pre treatment screening to monitoring and patient education, these steps are crucial for balancing efficacy with safety.
Brilliant summary as always, Prachi. And thank you to our listeners for tuning in. If you found today's episode helpful, don't forget to subscribe and share it with your colleagues. Join us next time. Until then, stay curious.